Drug addiction. Drug addiction is very rampant in today's generation. This is Ed Sumiog. Good day to everyone. Now without further ado, let's discuss drug addiction, also called substance use disorder, is a disease that affects a person's brain and behavior and leads to an inability to control the use of a legal or illegal drug or medication. Substances such as alcohol, marijuana, and nicotine also are considered drugs. Drug addiction may lead you to something you don't like. Do you want to be like them? Watch for these physical signs and symptoms that can occur when substance abuse. These signs are perhaps the easiest to spot for both the substance user and loved ones. Changes to the outward appearance alert others about the problem. It may take time to notice some of the changes, but as the addiction progresses, the physical effects tend to increase, making them more noticeable. The addict may also be aware of those physical symptoms when looking in the mirror. Internal physical symptoms aren't easy to spot for others, but the individual abusing substances can feel them. Nausea and headache are two examples of symptoms felt by the individual but not easily detectable by others. First, the eyes. Drug and alcohol use often shows itself in the eyes, which may look red or bloodshot due to the offensive chemicals in the system. Some addicts may try to cover up those signs by using eye drops excessively. Dilated pupils or a glassy appearance can also indicate substance abuse. Second, nose. The individual may sniffle or have a runny nose without any medical cause. This may also have frequent bloody noses. Third, lack of coordination and slurred speech. Being under the influence may cause lack of coordination or balance issues. Some people experience slurred speech or other changes in speech patterns while under the influence of drugs or alcohol. Bruises or infections. The injection site for certain drugs may appear bruised or infected. Other bruises or injuries can also happen due to the loss of coordination while under the influence. Frequent illness of addict. Whether or not the addict is actually ill, they may often say they are sick to cover up the ill feelings often caused by drug or alcohol abuse. They may also use sickness as an excuse to miss work to spend more time drinking or doing drugs. Fifth, weight change. Drug or alcohol use may cause sudden weight gain or loss. Clothes may fit differently. Many drugs stimulate energy, causing the person to go non-stop without feeling the need to eat or sleep, which can lead to significant weight loss. Recognizing unhealthy drug use in family members. Sometimes, it's difficult to distinguish normal teenage moodiness or angst from signs of drug use. Here are some possible indications that your teenager or other family member is using drugs. First is problems at school or work. Frequently missing school or work, a sudden disinterest in school activities or work, or a drop in grades or work performance. Second is changes in behavior. Exaggerated efforts to bar family members from entering his or her room or being secretive about where he or she goes with friends, or drastic changes in behavior and in relationships with family and friends. Third is money issues. Sudden request for money without a reasonable explanation, or your discovery that money is missing or has been stolen, or that items have disappeared from your home, especially appliances, indicating maybe they're being sold to support drug use. Fifth is physical health issues, a lack of energy and motivation, losing or gaining weight, or the redness of eyes. Here are the 10 factors of addictions. Genetics. Genetics is a major risk for addiction. In families with a history of addiction, children are 40 to 60% more likely to have addiction problems. Trauma and abuse. Parental neglect, verbal abuse, physical altercations, sexual abuse, accidents, and natural disasters leave their mark on the mind, and people exposed to these issues are more at risk to soothe their distress by using drugs. How drug is taken. Drugs that are smoked or injected enter the brain in seconds and are far more addictive than those you swallow. The high soon fades away, leaving the person more likely to use often and in higher doses. Mental disorders. If you have a mental disorder such as depression, OCD, attention deficit hyperactivity disorder, or ADHD, you are more likely to become dependent on drugs. Peer pressure. Peer pressure is a powerful influence on whether you drink or if you use drugs. If your friends are using drugs and alcohol, you are likely to use them also. Home and family. Those growing up in homes disrupted by divorce, mental illness, and parents engaging in drugs and alcohol are at a higher risk for drug abuse. School problems. Students who have failing grades, poor social skills, a learning disability, skip school, low motivation, poor bonding with teachers and classmates are more likely to become involved with drugs or alcohol. Type of drugs taken. Some drugs are more addictive than others. Drugs like heroin, cocaine, amphetamines, and nicotine are more quickly addictive than alcohol and marijuana. Addiction scale. First, heroin. Second, cocaine or crack. Third, nicotine. Fourth, methamphetamine. Fifth, alcohol. And sixth, marijuana. Gender. Men are more likely to have problems with drug addiction than women. However, the progression of addiction is known to be faster in female. And here are some horrific effects of drug abuse. My recommendation for prevention, as an individual, especially teenager, one should not isolate themselves from their family and friends. Engage themselves in any activities, whether in church activities or government activities that promotes goodness to the youth and society. If affected already, one should seek help to his or her family in order to put action to prevent from fully under addiction. If you're already a drug addict, cooperate from any actions from your family or any person that helps you getting out from it. A friendly reminders, my friend. Help yourself in order others will help you.